All right. Welcome back to the Raise Performance Podcast. I am Andy Ray. I help men in their 30s, 40s, and 50s solve all of their niggling injuries, build huge strength, and rebuild unbreakable confidence back in their body. Not just to be pain-free, but to perform at their very best again. So my work is built around the Raise and Rebuild. I take people through a structured process that gets people out of a cycle of niggles, breakdowns, and stop-start training, gets them back to moving well, feeling good again, training hard, and doing things they actually care about without getting injured. So today's episode, we are going to be talking about skiing because the time is nigh. And more specifically, ACL injuries when skiing and why they're so common on the slopes. This is especially for people who are fit, active, and confident on the slopes. But we want to give a little bit of advice on why these injuries are so common, what we can do before we go to solve them or to at least reduce the risk, what we can do while we're there, and then if the unthinkable happens, what that looks like and how to get the best out your rehab for your ACL injury. So today I'm joined by my old mate James Phillips. We used to work together at Pure Sports Medicine. We were both in strength and conditioning. He's now moved on to his own ACL based. He presents a course called the Complete ACL Rehab Course to physios, but he'll also help clients with their ACL and knee pain problems. Do you want to give yourself a little 1-minute intro, JP?
Yeah, sure. Yeah. So thanks for having me on, Andy. Looking forward to the chat. So I'm a strength and conditioning coach, like Andy said, and very similar to Andy. We obviously work together at Pure Sports Medicine. I guess my journey to getting to this point has been obviously through sport, as most of our strength and conditioning journeys are. I worked in pro sport, in rugby, in fencing, and a few other sports. I then into the rehab space at Pure Sports Medicine, where I worked there for 8 years as an end stage rehab specialist. So that involved working alongside physiotherapists and other medical professionals in getting people back to doing what they wanted to do. So skiing, football, rugby, running marathons, doing triathlons, whatever it was really after the injury that they sustained. So built up a lot of reps and got into ACL rehab there through working with a really good friend of mine now, and who now run the ACL rehab course with, Andy Goodall. We basically built our sort of um, course, but around our practice, whereby he referred me lots of ACL patients because he saw a lot of knee and ACL patients, and we worked very closely together to get people back to doing what they wanted to do. So I worked alongside him very closely, and obviously the other physios there, but basically got reps and saw a lot of ACL clients there. That built out our course, which we've been running for 4 years now, which is, as Andy said, it's a course designed for physios, but other practitioners as well, to learn about how to rehab people back from an ACL injury. So it's a 2-day course, and we teach people on exactly how to do that or how we've done it, and the sort of framework and structure around the whole process of getting people to return back to doing what they want to do. So I've been doing that. We're trying to get it to a wider audience. We're trying to get it online. So that's the process that we're in at the moment. And I now work in a sort of private facility in Soho near Tottenham Court Road Station, where I work with clients to basically work with them after injury, at whatever sort of stage of injury that is, but often mid and late stage, and again getting them back to doing what they did want to do and trying to make sure that it doesn't happen again. So I work with anything from a weekend warrior to semi-professional players and athletes of all different shapes and sizes, really.
So we're really in quite a similar space, aren't we, really?
we're doing a very similar job,
Your yeah, I
in a
think
slightly
yours.
different way.
Yeah, and so I think your specialism is certainly knees from your course and from that sort of stuff, and then
Yeah, you sort of niche down a little bit, don't you? And that's a interest of mine because you work with people that are active, that are keen, that want to get back to doing a sport, which again, in the strength and conditioning world, we've got into that more often than not to work with people who are looking to return to a sporting environment. So that's what I get a kick out of. I enjoy seeing people that want to do that. So yeah, the ACL client tends to be that type of person.
float your boat.
They float my boat.
They float your boat. So let's start, shall we, with the obvious question. We see, well, 'tis the season, and now you'll see a lot of ACL injuries from skiing. Why is it such a sort of perfect storm skiing for ACL injuries?
Um, the obvious reason is that you have a very long ski attached to the end of your foot. Um, the issue with that is that this ski, you don't want to get too physicsy, but the ski creates a very long lever. That long lever then creates high rotational forces around the knee in particular because you're strapped into a boot. Yes, bindings should release, but sometimes they don't. And that lever creates those high moments, those high forces, which then travels up through the knee because the ACL is effectively designed to stop your knee, your lower limb translating forward relative to your upper limb or your tibia and femur, and also to resist rotation, which this long ski at the end of your foot then adds much more force going through that. So, accompanying that with the fact that you are falling downhill with style, hopefully, but
Yeah.
not, um, you then have large forces when you're going downhill. You have this snow that you don't necessarily know exactly what's going to happen. So there's sort of an unanticipated environment around skiing. Um, and then coupled with the fact that um, typically for the recreational skier, they might not be as well conditioned to ski because there's often short trips, right? And they don't happen very often, once or twice a year, maybe.
And that's
Uh,
something we'll get to. How maybe
and we will get onto that, I'm
yeah,
sure.
how we can prepare. So
Yeah,
I mean,
there's a
from,
myriad of factors.
yeah, and but from a sort of mechanism of injury point of view, would you say that the most likely is the rotation, or is it?
So the, there's your classic professional type skier. If you're watching the Olympics, and there's some alpine style skiing going on, that type of mechanism of injury is very much high force. They're doing a high load when they're turning round the gate, for example, and typically what happens there is they might lose the outer leg contact with the snow, therefore going onto one limb. As they're going around the corner, they're trying to get that limb back, that foot back in contact. As they do that, there's the unknown environment of how that's going to react with the snow, and then they kind of balloon out of that position because there's a big rotational demand when they put that limb back down again. So that's called like the slip and catch mechanism, which is very typical in higher level skiers. There's then a few other mechanisms which are um, falling forward related. That can be that your torso is in front of your hips and your knees. You've got a quite extended limb, so the ACL works to obviously resist this translation forwards, and basically when topple forward, your ski might catch at the back, and that then creates this again shearing force through the ACL. There's then the classic like snowplow position. If you if you're in these types of positions, then knees are quite internally rotated, which puts that ACL at a particular stress. And then if you have a perturbation or a position where you don't know what's going to happen, and then there's excessive force through that, then that's a position which can be a typical mechanism. Um, And then there's a few others where if you land off a jump or um, the heel of the tail of the ski catches the snow first, that forces the front of the ski to come forward. If the binding doesn't release, that means the shin kind of like translate forwards loads, coupled with the fact that you're landing, quad is kind of trying to be quite active to make sure that you don't fall back, because ultimately that's what you're likely to do if you land with the tail of the ski first. That then really forces the tibia or lower limb to translate forwards loads, putting loads of tension through the ACL. There's a few different mechanisms by which it happens, but ultimately it's where the ski creates that excessive stress and force, and coupled with this internal rotation aspect of the ski.
And what do people sort of describe it feels like?
Typically, people might say they hear like a pop, um, and they feel afterwards. You hear some people say that they can carry on, some people say that they can't carry on. Um, there's often, as a consequence of um, the high forces going through the knee and the element that you don't know quite what the ski is going to do with relation to the snow and the mechanism that you have, there's often a lot of other structures which can be injured as well.
Yeah.
The MCL, the cartilage, the meniscus. So you can have a multi-ligament injury from this. It's not always just an isolated ACL.
Yeah.
So you'll typically get a big amount of swelling straight afterwards. And I guess probably something for the listeners to bear in mind is you probably don't want to get surgery there and then. Typically, they might be sold surgery quite quickly
Mm-hmm.
to fix the problem quickly.
Yeah.
This isn't a good environment for surgery to happen in, because you've just had a big injury, big swelling. Um, you really need that knee to calm down. If you listen to a lot of surgeons and consultants who operate on ACLs and knee injuries, they often say that they would love to have a period of time from the injury to actually providing surgery, and that's probably at least 6 to 8 weeks, maybe even 12 weeks before they actually do the surgery, and that's to allow the knee to quieten down.
Yeah, I mean that's a great bit of advice, because actually I've heard that a few times. People get carried off the mountain and they're not sure what to do, and they get sort of sold
Yeah.
this treatment, and however that looks. But actually, fundamentally, don't ski on, get yourself down, get yourself rested, get yourself home, get yourself to an expert that you trust, essentially.
Yeah, yeah, basically get back to the country.
Yeah. Oh, well, look, before we sort of delve deep into what the rehab stuff looks like and the operation as well, let's talk about how people might prepare for skiing. So, what would firstly, obviously, people are going to go skiing relatively soon. So, some people may be going now, some people may be going over the next sort of few weeks. Would you say that there's some benefit? In fact, first of all, what would you do? What will help offset the chance of an injury like this?
Um, as I sort of alluded to earlier, um, people don't often ski regularly. You do have the odd individual. I have a client that loves skiing so much that he'll go every other weekend. But typically, with most of our clients, they'll ski maybe once or twice a year. Yes, that's coming up soon, probably because of the snow. But ultimately, you're you're not very ready, ski ready from doing it regularly itself. People that play other sports, you can play other sports quite regularly, and therefore you are in inverted commas match fit, because you've built up reps of doing that and time of doing that. But with skiing, you haven't. So working back, if you've got a trip coming up, um, I would say that first of all, you need to have a certain level of physical strength. Because of the downhill element of skiing, there's a lot of deceleration going on. So you have to absorb a lot of force. We know that in ACL injuries, they often are in a high force environment. And if you can't accommodate those high forces by generating high forces, then you're putting that at a higher risk. So basic high load strength training, building obviously yourself up to that can be very, very useful. And obviously you're targeting the lower limb. Um, so single leg movements, squatting based movements where you bend at the knee and hip, um, should be relatively fundamental. Um, Building yourself up to more single leg tasks, so that you have an element of control and stability whilst squatting on one leg is obviously very important. And then progressing to higher loads so that you have the ability to produce high forces through that limb.
I was just about to say that actually. So I think just to sort of simplify this, essentially when you're going down, you need to be able to decelerate your muscle. You have to decelerate your body. So you have to slow things down. I think what JP is saying is you need to, in order to slow that down, you have to be able to send force in the opposite direction to slow it, right?
Yeah.
So you have to push back the
Use
other
the
way
force.
to slow the deceleration. You have to accelerate back essentially through your limbs. Now, and like you said, I think the key to this is the high load thing. So you'll start to see people, doing some sort of ski based training, and they'll be on a Bosu ball and they'll be in that sort of squat position, and they'll try and mimic skiing. Now, I think that's a fundamental problem with a lot of people's training is they try and mimic the thing when there's absolutely no way that you can mimic that sort of level of force. And doing balance exercises and stuff on a Bosu ball, it feels like it's similar, but it's just not. Now, what I always try and explain to people is there's sort of two types of strength I feel like you need for skiing. Firstly, you need to be able to lift some heavy weight. Okay, so like I said, you need to accelerate back against that deceleration when you're going down. So that is heavy loaded strength training. Now, skiing looks like it's on two legs, which it sort of loosely is when you're going in a straight line, but actually when you're turning, you're doing a lot of work on single legs. So I think a mistake that some people make they'll do a lot of double leg training and try and mimic that exact position. But actually, when you're moving, you need to be strong on a single leg as well. So sort of good high load or relatively high load for you strength training is really key. And then I think of something I call reflexive training. So, when you're walking, you trip over and you catch yourself. That's your reflexes working. Now, when you're skiing, there will be times when things move and your skis flick, and that's the same thing. It's a reflex to catch it. So I think there's two sides to this. You probably need some heavy strength work in there to make sure you're strong enough to resist those forces, but then your reflexes also need to be quite sharp in order to be able to very quickly catch you when that ski goes out a little bit. Would you agree with that?
Yeah, absolutely. I think that element would certainly be once you've developed the tolerance or ability to produce higher forces through high load strength training, and probably in particular, if we go a bit sciencey, a bit the eccentric portion, which is the lowering
The
portion
lowering,
of
yeah.
lift. And the reflexive part is the ability to load eccentrically quickly and, as you said, catch yourself in a position which would be you could put we can talk about periodization and programming all we want, but
Let's keep it simple.
that's that's a different podcast. You could do that at the same time, or you could do that afterwards, depending on the amount of time that you've sort of allowed to build up to skiing. So from a gym perspective, you could do those two things certainly to prepare yourself neuromuscularly. There's then, I guess, your point on the Bosu ball, why people mimic that scenario is being in that position for an extended period of time. The research does suggest that in skiing, which is probably different to other sports, but in skiing, fatigue is a bit of a factor. You are more likely to tear your ACL at the bottom, at the end of a run, than at the start of a run,
Yeah.
which is actually a bit different to sports like basketball, football, rugby. But In skiing, fatigue is a factor. So preparing yourself from an ability to get used to that position, it is probably why people do that, but it's maybe not for a different reason. So I I would certainly look at people's ability to produce power, force quickly, repetitively, to very, very close to someone's ski trip. So, for example, I've been training someone to prepare for a ski season. She's going out after Christmas, skis all the time. Her family has a chalet, so she would class herself as a good skier, whatever that means. But she would be confident. But she's going on a ski season and she's done her ACL. So she has come to me, a referral from the physio, um, and I've been working with her since September. Now, my initial port of call was to, try to find any deficits, asymmetries. We ironed those out, and then we went through a period of going, right, high load work. Now we've gone through a period of reflexive catching work, so landing on one leg in lots of different ways, and also having to think about your trunk a little bit as well. That's probably something that people forget. And then the last little bit, just before, a few weeks before, it's a case of going, right, do lots and lots of reps, trying to be as powerful as possible in a squatted type scenario to try to get someone's endurance and specifically power endurance improved, which is a quality which you can probably change quite quickly versus strength, which takes a long time to build up.
Yeah. Okay, so just to break this down then, I suppose to make this simple for people listening, there needs to be a strength element where we lift pretty heavy loads, which would look like your strength training. It would be in the gym, it would be squatting, single leg work like split squats, step ups, the leg pressing, anything you can think of that loads the legs heavy.
Yeah.
Then we've got the reflexive stuff, which is it's essentially hopping, landing, plyometric based exercise. Now there's there's quite a lot of nuance to that, isn't there?
Yeah, I would say that the main thing that we are looking to promote is someone's ability to land in a flexed position, but not really stiff. We don't want someone's leg very straight when they land. We want them to be able to bend it quickly, catch themselves in a good position without any sort of deviation from that ideal position.
Yeah.
Yeah.
And then the final third point then would be the endurance. So it's trying to make sure that now they're strong enough, now their reflexes are firing, then they've got the endurance. So when they get to the bottom of the slope, they feel their legs still feel good enough to cope with the amount of sort of stress going through them. Is that fair?
Yeah, exactly. Because ultimately the same forces will be going through the leg at the start of the run than at the end of the run. And only at the end of the run will you be more fatigued than at the start. So you need to be able to handle that.
Yeah. Yeah, absolutely. Now, look, obviously, we talked a little bit earlier about this is the season, so people are probably going fairly soon. From my perspective, I actually think you can. It's slightly more difficult to build muscle mass, I think, over time. That takes a bit of time. I think the strength is a slightly different matter, and I'll explain. When you strength train, generally, in the first 4 to 6 weeks, you tend not to build a huge amount of muscle. What you tend to do is you almost just reconnect the dots between your nervous system and your muscle, and it allows your muscles to work at a higher rate. So, for example, if you have only done walking for the whole year, your legs probably won't be at 100%. Your muscles won't be functioning at 100% because your body doesn't need them to function at 100%. I think with strength training, if you were to do strength training over about 4 weeks, if you could put pressure on those muscles, they would get stronger. And all it is you using what you already have for your muscles to function better. So if you're at 50% when you start the strength training, in 4 weeks, I think you could get them up to, let's arbitrary number, but you get them up to 80%. So I do think would you say there's if someone was going skiing in 4 weeks' time, would you say there's still value in starting a strength program now? And if there was, what would you prioritize first?
Never too late to start.
Yeah,
Definitely never too late to start. Um, I would then prioritize. um, you would start with whatever they are obviously capable of tolerating.
yeah,
There's an element that, if we're being thinking about it, that we certainly don't want them to go into a ski holiday sore. So you would maybe limit the amount of really high loading work. You would use a moderate load where you know that you are getting some activation, because as you are sort of referring to, you just want to make sure that they can feel the muscles working. Um, you could also, I would probably then prioritize maybe machine work over a bit more, because you are more likely to get higher load work and therefore muscular recruitment. If you've got someone that isn't well trained, wants to start something, machines is quite a good way to go,
yeah,
bang for buck. And then also you can isolate muscle groups. Quadriceps and hamstrings and calves we know are very important to withstand those forces from the slopes, but also and therefore to protect the ACL. So those would be your knee extension, your hamstring curl, and preferably a seated calf raise, just because of the position that you're likely to find yourself in on the slopes. So I'd maybe suggest that.
yeah. And yeah, I suppose that's exactly it, isn't it? It's you are where you are now. We want you in 4 weeks' time to be better than where you are now. And whatever that looks like, and whatever the best way of getting to that point is, then we go down that route. And like you said, I'm a big fan of machine work. Like a lot of the people I see will come to me and they want to get back to you. So, oh, I used to be able to squat this. I used to be able to deadlift this. Sometimes I think you just need to give that up for a bit, because actually we can get much more load through your legs much more safely using a machine like a leg press. But anyway, that's sort of outside of this conversation. But so essentially, I think what we're saying is it's never too late to start strength training. You will see a benefit from strength training even after a couple of weeks, frankly. Obviously, the longer you can do it for, the better, because then you can start to incorporate in these sort of plyometrics, deceleration, hopping, landing, that sort of stuff. And also it takes a little bit of time then also for the third thing we talked about, which was the endurance. But just sort of reading between the lines, would you say that like the strength work would, if you had a 4 week window, would you say the strength work would be your priority to start off with? Or would you try and mix a bit of everything in?
I would only mix the jumping and landing work in if they
Could tolerate.
demonstrated that they could
Yeah,
go into good positions.
yeah.
I would only do. Always it depends is the answer that
It's
we always
very
say.
individual. I suppose it's just very individual, isn't it?
Very
It's where
individual.
someone comes in. Yeah,
How
if
many
they come
times
in
a
and they
week
can,
is, yeah.
yeah, if they can do these things and they can lift this amount of weight, then you think then they can move on to the next stage. Whereas if
Yeah,
not,
because
you start.
someone might come back, might be a completely different individual who is well trained, used to be well trained, used to be a rugby player, used to do a lot of high load work, hasn't done it for a while. Um, they might just need to might have underpinning levels of strength, because if you worked on strength for a long time, then you don't lose it as quickly. But um, so for that individual, it might be a bit of high load work, a bit of jumping and landing, and then at the end of the session, just get used to some fatigue. You might do all three in one session. Depends how many sessions, depends on their background, depends.
Yeah,
Which
absolutely.
is why everything should be relatively individualized, even though we're all doing the same thing and we've all got relatively similar bodies.
Yeah, but we all start from different places.
Yeah.
Absolutely. All right. Now this may be there's a few obvious ones in this, but when you are skiing, so you have if someone hadn't prepared perfectly, you go skiing. Is there anything you would sort of suggest that might help while you're there?
To reduce the risk of injury.
Yes.
I think the first and obvious one is ego
Yes.
would be my first one because if you feel comfortable doing the run and the the skiing feels within yourself, then you are not pushing your boundaries and your limits, both physically but also mentally and technically. And then you're much less likely to put yourself in scenarios by which you are increasing that risk.
Yeah.
Just by virtue of doing a easier run, the level is lower, you feel comfortable and confident, you're not going to fatigue yourself as much, and you're going to reduce that relative risk. The way that I would think about um, skiing is and ACL risk is the amount of opportunities or episodes by which you could injure your ACL. If you are going into it with poor preparation and you're going into it at a high level, the number of times that you put your ACL at a risk or at high levels of strain is much more frequent as a percentage. So if you were to do that run 8 times in the morning, I don't know how long it takes, um, you might have 4 episodes per run where that could put your ACL at strain. The more opportunities there are, the more strain, the more opportunities there are for it to go. But also, the ACL is a ligament, and just like anything else, it might fatigue, it might have micro damage in it. So the easier the run, the less opportunities there are, and the less load that's going to be going through the ACL. So that would be my first one: is leave the ego at the door. Don't try to do anything you can't do. I would also say on that, if you're not a confident skier or you haven't done it in a while, maybe just to have a lesson to start with. You know, learn the basics again, get some confidence back. Um, I would then say, yeah, you could do a little warm up beforehand, to make sure that you aren't going it completely cold. Um, that could be as simple as doing some quick squats. That could be as simple as doing some jumps. That could be as simple as um, uh, there's a few different things that you could do for sure. Doing that before the run, doing that after lunch, every time.
I
Yeah,
mean, on that point, it's sort of again, it's sort of that slight activation, isn't it? It's just getting your body prepared, it's getting it warmed up, it's getting it ready to take the
yeah,
forces essentially. So if you go in cold, your body's not ready, and then it increases the risk.
yeah.
Whereas if you're a little bit warmer and you've done a few of them before, your body's switched on, your nervous system's ready to go, and you're good to go.
Exactly. The other thing, again, in the literature, there's a high proportion of quoted injuries where the binding hasn't released. So check your binding. Check it at the start of the run. Check it before you get fitted. Make sure that you're confident and comfortable that you're not relying on it. You're not assuming, because a high proportion of injuries do occur because it hasn't released.
Yeah, and from a sort of fatigue perspective, is there? I mean, you said it a lot of the time. It will happen at the bottom of the run. Is there any sort of data to suggest that it would happen at the end of the week?
Not sure about that. I haven't come across research on that. Um, I've only come across research saying that it happens more at the end of the run, but
Yeah,
by virtue of a certain type, at the end of the run, you've got a certain type of fatigue in your system. It's accumulation in a short period of time, high density of work. If you were to jump back on the lift, get back up to top, go again, then the amount of recovery that you're getting between each effort and bout is reduced. Equally, you could look at it of how long is the run, maybe choose shorter ones so that there isn't as much fatigue at the end of the run. And I would maybe then say a useful return to skiing idea is to ski within your limits, by which you are strict and you give yourself, okay, I'm only going to do this number or for
yeah,
this length of time,
yeah,
and you stick to it. If you then are strict on that, then you have a more like you let much greater chance of you being fresh when you do ski. I think that's important. If fatigue is a factor, then be fresh.
Yeah.
Take your time going back up. Um, Make sure that you aren't pushing yourself at the end of the day. Make sure that at the end of the day, yeah, I'm sure there is some trips where you do a lot of après skiing, but um, if you rest well, eat well, and you go into the next day feeling not battered, then you'll probably be all right.
Yeah. I mean, my ski history is I went when I was younger, then played rugby, so contractually just wasn't allowed to go. And I went a couple of years ago, and then again this year. And I lift reasonably heavy. I consider myself a pretty fit guy, but if you go down a long run, your legs are on fire, aren't they? And I think especially if you just haven't had that, it's just different, isn't it? You haven't had it for that long. You can't really mimic it. You've just got to take a little bit of time.
Yeah,
And I
you've got
suppose,
to unfortunately use your short trip to relearn
yeah,
and certainly refamiliarize yourself with the technique, what it feels like, build reps, for sure.
yeah. And then I suppose there's the obvious one of don't get hammered while you're up there. Maybe we don't need to cover that one too much.
I don't think we need to cover that one. You are certainly putting yourself at a detriment from a cognitive perspective. um,
I've never quite. At some point, they're going to have to it's all going to be cut, and there'll be complaints. But actually, thinking about it, you're like, that is so much more dangerous than anything, isn't it? It's like it's more dangerous than drink driving. It's more dangerous than anything. You're hurtling down a slope. It's just madness that it's even allowed.
Yeah. In the
Anyway,
research, there is certainly a section of contact injuries, and you do wonder what scenarios those contact injuries occur.
yeah, absolutely. Well, that's funny. Well, that's actually another thing as well, isn't it? It's a lot of the time these things happen because it's other people's egos. It's people who are just out of control and hurtling down. You just got to be aware, I think, haven't you, of your surroundings. Okay, so now let's talk about the bit that no one really wants to think about. Then, what if it happens? You've suggested that right, you're off the slope. Don't think about getting it done there. Get yourself back. Get the swelling down. What are the surgical options? So you've got sort of surgical and non-surgical, right?
Yes,
So
yeah.
what would you say? It may be too much of a broad question, but do as well as you can. What would you say sort of the benefits of surgical versus non-surgical?
So, so yes, you have surgical, non-surgical options, conservative options. The surgical options are then kind of dictated by the level of injury that you've sustained. If you have other ligaments that you have and meniscus that you've injured, you're probably more likely to get surgery. The decisions as to why you maybe wouldn't get surgery would be dictated by the level of injury and the scenarios by which conservative management can work. So, in as I said at the start, in skiing, concomitant or other injuries as well as the ACL can be quite common.
Yeah,
If you have an isolated ACL injury, then a conservative route could be an option because there's some new research and evidence coming out that our ACLs or our ligaments can heal. This is the research is quite new. There's a lot of information that is unknown around that. And as a consequence, the research that has been done in it's only in a specific cohort by which we see that healing occur. If you are to be, and then there's like a protocol to promote that healing to occur, but that protocol is quite invasive in that you are very fixed. Your knee is fixed at a certain angle for a period of time. So it's only for a certain type of person that they would want to do that. People can function perfectly well after an ACL injury if they don't have surgery. However, again, you only likely do that if you are very consistent with your rehab, if you are very pro um, with physical activity being and strength training and the rehab being a real focus to getting you back. And also, you have to, I guess, bear in mind that if you have episodes of instability or your knee giving way, then that is your knee telling you that it's probably not coping very well without the ACL. So you can manage conservatively very well. Lots of people do. If you are having episodes and frequent episodes of instability, that's a sign that you're not coping well without an ACL, and reconstruction probably should be advised. If you a lot of the level of activity in skiing will probably dictate whether you have surgery or not. Those that are wanting to return to high level activities, skiing and sport, are more likely to get surgical intervention. And then it's a case of, well, what are we going to replace the ACL with? Because it's often a graft that is used to recreate the ACL or the ligament, and that's then taken from either a certain part of your body. There is then also an allograft as well, but typically there's often in the younger cohort you get your own
Just
tissue,
if people didn't know, what's an allograft?
someone else's ligament on someone else's tissue,
Yeah.
basically. So um, issue with that is that sometimes it doesn't harvest very well, it doesn't reattach very well. Sometimes it does, but then it attaches quite quickly. And so then people might have the perception that the rehab is going quite quickly. That's a bit of a risk. Um, Typically, people have probably their own tissue, but then you have the issue of you've then had tissue taken from somewhere, hamstring, patella, quad, tendon, and that's an injury in itself that you then have to manage and rehab within the process.
Yeah. Okay. So look, there's quite a lot of information there, right?
Sorry.
No, that's absolutely fine. But no, that wasn't. It's good to know. But I think if people were listening and they weren't sure what to do, I'm assuming the best bet is just to find someone who you trust and who's an expert.
Yes, I would say that you could either seek a physio that is a specialist in ACL knee injuries.
Like your good man Andy Goodall.
I would always promote Andy Goodall as being a first port of call. He's very knowledgeable and very experienced, and works with some of the best surgeons in London, and only works with a handful because he likes to work with the best. So, as a consequence, you would then be working with again some of the best ACL surgeons in or knee surgeons in London. They would, I think, your consultants of choice can vary depending on their outlook. Some people are very pro rehab, some people are very pro surgery. So having someone that is thinking about you, not themselves, is something I would try to advise, which can be tricky. But I would then also say that if you have a consultant's opinion alongside a physio's opinion, then you're getting two sides of the coin, not just the surgery side, but also the rehab side of things.
Yeah. So just to essentially take your time, get some opinions. If it doesn't quite feel right,
Yeah,
seek something else
there
out.
is no rush to get surgery. And as I said earlier, actually you do want some time before getting surgery after the injury because you want the knee to calm down. And actually you can do some rehab before surgery. There's a lot of evidence to suggest the better your knee, the state of your knee is in, and also the physical condition you're in prior to surgery will dictate how well you come out of surgery. So actually, you do have time. You don't have to get surgery ASAP after the injury, and it's probably advised to actually wait. So therefore, you have time to go and kind of assess a few different options for sure. And it's specific to the UK, the NHS can have some long waiting times. So people have to rehab after the injury, not knowing quite when their surgery might be. And then they get themselves into a pretty good condition. And then in some cases, they don't choose not to have the surgery because they're managing very well and they're doing conservative management. Um, so I would say don't rush it. Seek advice both from both sides of the coin, surgery and rehab side of things, so that you want those two individuals to be used to working with each other as well.
Perfect. Great advice. That is great advice. So, moving on to the rehab side of things, what does now ACL rehab used to be very time dependent, didn't it? It's like there would be a time that this happens and a time that this happens and a time that this happens. Now I'm sure there's still an element of that, but how have things changed recently from a criteria type perspective?
Yeah. So you're what you're referring to is that there's a particular paper and group that have come out recently from Aspetar who have done loads of research into ACL, and Enda King, who has been underpinning that for a long period of time, is one of the best researchers in the field. Anyway, he and his team have sort of demonstrated that typically you'd hear maybe in the research about someone having an ACL, in the media, someone having an ACL injury and therefore it being 9 months until they are likely to be back doing what they want to do. That was disproven essentially by this research group, which basically said it doesn't matter when you return. What matters is that you pass all of the exit criteria, the criteria to suggest that you have restored all of these elements to be able to return to the sport or to the activity. And so ultimately, yes, there used to be timelines. They were probably just averages of how the time period that people got to that point. You know, in early stage rehab, people use 3 months. At 3 months, they should be starting to run. At 6 months, they should be starting to do agility work. And at 9 months, they should be returning to sport. Well, ultimately, you'll hear some people returning faster than that and perform absolutely fine and return absolutely fine. But those people have passed their criteria to do so. They've earned the right to get there.
Yeah.
And then some people, it takes longer. There are complications. I mean, ultimately, if you enter surgery in a better state, then you come out of surgery better. You're likely to have a faster recovery in the earlier stages. And if you are a strong, fit individual prior to that injury, then the likelihood is that it doesn't take as long to restore some of those qualities afterwards. So in the elite athlete, not only have they had surgery, but they've been in a better state prior to surgery. They are diligent with their rehab. They're rehabbing every day. They have the best individuals helping them with the rehab, and they can recover from the rehab because they have the environment to do so, because they're an elite athlete and they don't do anything else other than train. So that's why you will see an elite athlete returning quicker than your, Joe average off the street kind of thing. And unfortunately, it probably takes at least a year, probably longer than that, for people to return because complications, because of the condition that people were in beforehand, because the lack of opportunity to rehab. People have jobs, lives, kids, and it's difficult to get the rehab done, and therefore it's difficult to recover from that, or it's not as optimized, if you like. So the journey just takes longer.
Yeah. But so fundamentally, if you were going to say to somebody, in order to, if you were to prepare for the worst,
Yep.
and even if it didn't happen, if you were to prepare for the worst, you would want to be strong going in. If it happened, then you have access to someone who can prescribe you strength work before the operation. And then you need to really be as diligent as you can with your rehab. And even within that time, there may be some complications. But we are really, without wanting to generalise too much, just so people sort of understand, we are probably looking at a year, aren't we? At
Yeah,
least, yeah.
yeah.
For
If you have a surgery, after that surgery, and if you
yeah.
have an injury after that
So
injury,
it's a long thing. And is there during the rehab, is there any bits that you find very difficult with clients? So I've heard from a few people who specialise in ACLs, and there's a sort of jump in function reasonably quickly, and then there's a little bit of a dead zone in the middle. Would you say that you find that, or not really?
yeah. I I would say people struggle with different parts of the rehab depending on um, the if they've had any complications after surgery. So um, I was speaking to someone recently, and they had, well, sorry, no, not speaking to someone. I work with someone who had surgery on a day after getting a knee injury on the slopes, and she had a lot of complications immediately after that surgery. Now that's N equals one, but she had complications, and that extended her rehab journey a lot to the point where she really and still struggles with quad activation. So quad inhibition is a very common issue that people can have because the ACL provides a lot of feedback, proprioceptive feedback. It gives you a lot of information to the brain about where the knee is in space and that sort of thing. Anyway, that can lead to your quadricep muscles, the front of your thighs, to sort of switch off or not work well. And you have to really work hard in retraining that. Um, and it's really an ability to recruit that muscle. And as you were saying earlier, that's part of how strength training works, is we get better at using that muscle. It doesn't necessarily get bigger, but that's a big issue that some people have, is restoring quad function. If they're Another issue is if someone has a graft, wherever that graft is taken from, if it's hamstring, patella, or quad, then that area will then lag. It will take time for that to restore as well. So if someone has a hamstring graft, which in the UK is quite typical, purely because of probable surgical preference, then restoring hamstring function takes a long time, because you've taken a whacking great bit of the hamstring tendon to put it in your knee. So you don't have the same capability those you once had. There's then people that aren't well trained, have a poor strength function, strength levels in general. So getting people to move well when introducing landing mechanics, single leg jumping, the sort of reflexive stuff you talked about earlier, can take a long time because
It's not been there
they
before.
it's not been their bread and butter. And so that can take quite a lot of time, certainly. Other aspects which, as you sort of, there are certain periods of the journey, of the rehab journey, which there is a big psychological barrier, fear, low confidence in your knee being able to do something. So, reintroducing running is a big step for people. That's probably one of the first things to get people to start to do again, which they haven't been able to do, and is we kind of feel that most people should be able to run, right, if they're an active person. So that's a big one to restore, and there's a lot of relearning about that. So I'd say that those are big factors. Getting people to produce force quickly on one leg. You put a box in front of someone, and people stand there and go, "Okay, I need to jump."
Yeah,
Oh, and there's this psychological barrier, and you can just see the cogs turning in their heads, going, "I want to do it, but I can't."
yeah. Well,
Um,
that's a really interesting point actually, because something I found in rehab is, and the difference between people who can see those things and can't see those things is different. So obviously that one's quite an obvious one, right? If someone stops and they don't want to jump, but there's a lot of nuance in and around when people have had an injury. For example, if someone was to jump on that box, they would do it differently using their injured knee compared to their other knee. You know, you see a lot of body swing, you see a lot of arm swing. They work out what your body's really intelligent, and it works out ways to do things. And that's where a really good practitioner will come in. It's like, right, can you do this thing? Right now, you just used that was just using your arms. Okay, so let's take your arms out of the equation. And then if they still cheat their essentially people will cheat their way to do it, but it's not cheating. It's just your mind, your brain is working out a different way of doing things. And I find that actually is one of the most interesting parts of rehab. You know, you watch how the body works out ways to do it differently, and you have to work and you have to think, right, how can I force it to do that job the way I want it to be done?
Yeah, yeah. There's
And
a
then,
there's a particular bit in the course that we teach, which is all about how the body compensates around this new injury, obviously.
yeah,
And the first, when you first reintroduce people squatting, they shift away from the injured side.
yeah,
So if you've injured your left knee, they'll shift towards the right. So you're reteaching them, okay, you're recoaching them, okay, well, you're shifting. Can you see you're shifting, etc. And then what people do is, okay, they shift, they're symmetrical from loading the left versus the right, but what they then do is they don't load the knee, they load the hip. So to squat, instead of bending the knee, they bend at the hip and they lean forward, and they don't actually use the knee. So although they're not shifting, they're not using the knee, they're using the hip instead to do the thing. And these are classic sort of things that we see along the journey, and you see that whenever you reintroduce something which is a bit newer, so squatting, running, jumping, and then the more specific you get to the sport, there's lots of obvious little ways in which we don't use the bit that's injured effectively. And that's basically the rehab journey is you introduce a new bit, you teach them how to use that bit again in the context of what you're asking them to do.
and then you tick them off, and then you hit the criteria, and
And
then
and,
bang,
and
next
yeah,
year you're skiing again.
that's essentially the criteria led aspect of it is we use objective data. So we use information that not only helps us to get an understanding of whether something is restoring, whether that's the quad function, whether that's the hamstring function, whether that's the strength, whether that's the range of motion. We use criteria and objective numbers and testing to help drive the decision making process, which ultimately if you just go, okay, well, at this time point, you should be able to squat. At this time point, you should be able to run. So therefore, we introduce it. At this time point, we introduce jumping because that's what you do. You don't care about how people do it or what they look like. Then you're just setting them up for a recipe for re-injuring because you haven't restored the function of the knee
Yeah.
in doing the aspect that for the task that you're asking them to do. Um, so, in my rehab with my clients, I use equipment to help guide that process. So, when we squat, I get them to do it on force plates to get them to. I get feedback from it. I get information from that technology. I use the same bit of kit to use when they jump, so I can see the depth of the jump, the confidence of the landing, how much force and power they're producing through each limb when they do those aspects. And so you use those numbers and information, not just your eye, because your eye can see some stuff, and the better your coaching eye and the better your rehab eye, the more likely you are to be able to see it. But actually, if you use very sensitive equipment to help with that process, then you've got the numbers to back it up. And then you can really be defined in your exit criteria. You know, I know that when you hit this number, you've got a pretty strong quad. Great, let's hit that number because once we get that, then we can move on to that. So that's
Yeah.
how the exit criteria comes into play for the rehab journey. Definitely.
And just final point on that, it's very much, you can use the data from a forced X, but if they do it in a different way, then it's not valuable. Whereas, if you do it just with your naked eye, you don't understand the numbers. So those two things coming together, if you can see they're doing it right, you can force them to do it right or give them cues to do it right, and you have the numbers to back it up, then you're much more likely to get a better outcome.
Absolutely. Yeah. So I would on the for people listening, you want a rehabber, you want a physio, you want a coach, you want someone that is using numbers and metrics alongside their experience to guide your rehab. I think that's really important because otherwise it's a bit finger in the air.
Perfect. Well, look, I think that's probably a nice place to finish. But what I want to do just to finish off with is just a bit of a summary, really. So I suppose from my perspective, what we've talked about is pre-skiing, we need to have a think about a few things. We need to think about strength training. We need to think about some form of landing. So whether that be plyometrics or hopping or just simple hop and lands, and some sort of endurance so we can actually get to the bottom of the slopes as fresh as we possibly can, not being too fatigued and not allowing, the sort of unthinkable to happen. When you're on the slopes, ego's a big thing. Try and just take it steady. I know it sounds a little bit boring, but I think what people have got to remember is if you're, well, I'm a bit older than you, but if you're my age and you haven't skied since last year, there is going to be an amount of regression from technique, from strength, and from your ability to do it. Now, I'm an ex-rugby player. I think I can do everything, and I certainly can't. And I think it's just having that thought process of, look, you're probably not exactly where you were last year or when you were 20, so you probably just need to have a think about not going too bonkers on the first few runs. And like you say, eat well, see if you can get some sleep. Obviously, you can have a few beers in the après, but don't go too bonkers when you're there. Yep. Then if the unthinkable happens, then don't rush anything. Probably don't carry on skiing. Well, yeah, you said some people feel like they can, but I would assume you would suggest don't. I know my mate did once, and he went from ACL to complete wreckage.
Yeah.
So off the mountain, don't be panicked into doing anything. Don't be panicked into surgery by anyone in a foreign country, because actually your best bet would be to get home, let it settle, do some preemptive strength work anyway, and
alongside some guidance, I would say.
Yeah, and spend some time with a professional who knows, probably two professionals, stroke three, where you have a coach that can help you with the strength side. You have a physio that can recommend what that looks like, but also a surgeon to go to. And then from there you have, a good outlook on what you're going to do. And I think a lot of the time that's the scary thing, isn't it? You're just not really sure if what you're doing is right. I think if you can get home and you can spend some time ironing that out, finding the person you're happy with and getting a few opinions, have your surgery, and then really from there it's finding a good rehab professional, but also I'm sure the main part of it is sticking to the rehab, right? And
committing to it,
yeah, and it's probably going to take you a bit of time. It's probably going to take you a year, but that's not to say that in next year or in 14 months' time or in 2 years' time you won't be able to get back to skiing. But it is going to be an effort on your part. Would you add anything to that?
Certainly. So no, I think you have summarised our conversation pretty well. I think if I was to rethink about what we said, there is only some little bits and bobs. So maybe binding, things that you can do which are maybe almost non-physical related. Check your binding and make sure that that's not something that you're relying on. Ego at the door, choose easier runs, ease yourself into it. And then, I think being within yourself as much as possible. The rehab specialists should be using criteria, not just their finger in the air. And you should anticipate that this is, as you say, going to be some work, some dedication to getting your physical condition back, and expect that it's going to be a bit of a roller coaster. Nothing goes smoothly, and certainly ACL rehab won't go smoothly, but you want it to be going in a trajectory in the right direction.
I always say this to people. It's like, this is never going to be a straight line. It is very much, as long as it's going generally up, it's a bumpy road.
Which is why if you've got a professional that's using criteria that can objectively tell you, no, look, last time you're here, it might not feel like you've improved, but you actually have.
Yeah, and
That
reassure you.
it's the little wins which help keep you on track, because it's a long rehab and it can be demoralizing at times. But the evidence, objective numbers to help guide you and them is super helpful and super useful.
Awesome. Mate, that is super helpful. I really appreciate your time. Where can people find you?
I'm on Instagram. My handle is optimal strength with an underscore at the end. Um, I have a website attached to that, optimalstrength.com. I work out of Soho near Tottenham Court Road Station. And I also have obviously run the ACL course, which is the Complete ACL Rehab Course.com. We run a few courses, about 5 courses in the year, both in the UK and abroad, depending. But we're also hoping to get that online. So check that out. Hopefully in end of Q1, maybe next year. Hopefully we'll have got that done. So yeah,
Awesome. Well, look, I'll put those links in the show notes. Mate, appreciate having you.
thank you very much, Andy.